The 2025 GEMS Symposium is underway, bringing together policymakers, healthcare workers and industry leaders to discuss the future of healthcare in South Africa. The event focuses on finding ways to make medical care more affordable, accessible and sustainable for everyone. For more on this, we now cross live to SABC News reporter Chriselda Lewis. Good afternoon, Chriselda. A very important conversation around accessible healthcare. Just share with us a little bit of what has been spoken of today.
And in fact, Mfundo, one of the presentations that was made inside was with regard to value for money, now talking about access, affordability, as well as quality. Those are some of the key words that we've heard from the presentations inside. How do you make, healthcare more affordable? How do you make it more accessible? But of course, most importantly, it's got to be the kind of quality of healthcare that, users would be able to be happy with. So a number of the delegates that have spoken have touched on this, but I want to bring in Dr. Stanley Moloabi, who is the principal officer at GEMS once again. We did speak to you, Doctor, a bit earlier on this morning, but a lot more conversations have been had inside. So there was a presentation about, putting members first, and this is beyond your one-size-fits-all kind of approach. Talk to us about the importance of that.
So, this is actually a question that we find faces us every year, where you find that members are different. You can imagine we have 880,000 members or more and 2.4 million beneficiaries. Each and every one of them has got a different fingerprints, and the same with their health. So what then happens is that because people are faced with this choice on a yearly basis to say, can I afford to pay this option? This option is more expensive, this one is cheaper. What is it that suits me? And to make that decision, there's mainly three considerations. To start with, can I afford it? Because there is a cost to everything. Can I afford the option that I'm going to choose? The second thing, what is the status of my health? Yes. That's one other thing. And then the third thing, and which we probably don't emphasize, is the stage of life of each and every individual. Now, basically, a newly married couple, is different from a young person who's just started working, no responsibilities. Right. So they take decisions differently. So those three are the cornerstones of deciding how much can I part with, in terms of a medical scheme. And creating value has been defined in many ways, but what we regard as creating value for our members is we really have to strive to make sure that the medical scheme is affordable. And it is a challenge, but what we are saying is that there are many ways. Firstly, we must try and make sure that based on the cover that you have, it covers you for the best part of the year, if not for the whole year. Yeah. But that also depends on how you utilize your medical scheme. That's a very important thing. And then also, the options, when we decide on the benefits, we have to try and match them. We group them into 5 options, and that's important.
Sorry, Doctor, before we run out of time, I just hear in my ear we don't have enough time, but I want to talk about those various options, at GEMS, and, how they designed. You did speak about them being tailor-made, dependent on which stage of life you're at, but just some of those benefits very quickly before we wrap up.
So that was actually the basis of my presentation. I talked about the 5 GEMS, and the 5 GEMS are the 5 GEMS options. So Onyx is at the higher end. It is for our members who are older, they have chronic disease, and they are more likely to use benefits. And then we have Tanzanite 1 option, which is the entry-level option. It's more affordable, but it's aimed at those who are younger. They fall sick less, and they are less likely. So those are the ones that use less medical. So the Onyx option is very rich or comprehensive. The Tanzanite is basically basic, and in between you try and cover the different levels of needs of members.
All right. Thank you very much, Dr. Stanley Moloabi. We know we had to get you out of the presentation, but thank you very much indeed for your time. We do appreciate it. The Principal Officer at GEMS, Dr. Stanley Moloabi, talking to us about some of the options at GEMS. And while, of course, you have healthcare that is expensive, they're looking at ways to ensure that those in the public service, which it covers, would be able to get quality healthcare, and of course some of the options that will be tailor-made for them.